Good afternoon, everyone. Welcome to the Secretary's Day webinar, Part 2. Today we will be discussing medical funders the pre-authorization requirements. I'm Wilna-Mari van Staden, your presenter. I qualified in 2003 and have a master's degree in physiotherapy. I'm based in the Limpopo province and run two private practices. I have been a part of the Physio Focus Committee since 2009. My personal motto is Carpe Diem, seize the moment. Do you have a general understanding of what pre-authorization and authorization is? Do you know how to obtain authorization? Did you know some medical funders require authorization before they will pay for the physiotherapy services rendered? What is pre-authorization? It's a decision by your health insurer or plan that a healthcare service, treatment plan, prescription drug or durable medical equipment is medically necessary. This happens prior to admission, prior to the treatment commence. Think of your dad having to obtain pre-authorization for a total knee replacement. Authorization is once a patient is already admitted into hospital for a certain procedure. Authorization policies may be in place to authorize any other additional treatment related to the patient's care. For example, lung physiotherapy for a patient being admitted for a total hip replacement. Medical funders institute authorization processes to be able to reduce cost, and at the same time they endeavor to have better clinically appropriate benefits to their members. Funders use what we call treatment protocols based on research to find the midway between best practice and appropriate care while also saving cost. Physiotherapists need to be able to prove that we render quality care, that we are helping in limiting the time of the illness, all while saving the funders money. By law, all treatment must be cost-effective, appropriate, and quality. Unfortunately, the practice of pre-authorization and authorization had become necessary, as funders needed to stop some bad apples for over-servicing, servicing where it is not necessary or clinically relevant, and to stop blatant fraud. Funders started with an authorization process as they were not sure why they need to pay for physiotherapy to walk a patient if they are already paying the nursing staff salary. To the funder, it seemed that they are paying twice for the same benefit. Another example is the ICU suctioning, where it is the nursing staff's role to suction the patient. The physiotherapist arrives in the morning and does the chest physio and suctions again. Why could the nursing staff suction at 2 a.m. in the morning and not the physio? The funder, needing to pay for the service, doesn't want to duplicate on services rendered. We need to understand that there are only so many Smarties in the jar, and once the Smarties are finished, funds are finished. All the healthcare practitioners need to get Smarties out of the same jar. We as physiotherapists need to be able to prove our relevance, and you as the supporting staff need to understand the vital role you play in the support of this intricate structure. Your correct administrative capturing goes a very long way to assist. So today, I can honestly say, we salute you. Who requires authorizations? Currently HOSMED, FedHealth, COMED, Bonitas, GEMS, TebeMed, Umvuzo Health, and Transmed. Let's have a look at GEMS. GEMS is the largest medical funder that requires pre-authorization. This is for all the benefit options for all in-hospital physiotherapy treatment. This is to ensure that physiotherapy treatment is approved for cases where it is really clinically appropriate and not an open check for treatment anymore. Authorizations must preferably be done on the website. You have 72 hours after the patient's admission in the normal business day hours to obtain authorization for treatment. Any late authorizations or applications that is seen as to be late will not be authorized and will therefore also not be paid. All authorization requests initiated over weekends, after hours, public holidays, and in emergencies, the service provider will be able to request authorization on the first working day after the admission. But remember that you can do an online application 24 hours a day, 7 days a week. Please remember that service providers will always be able to obtain pre-authorization via the web. Go to www.medscheme.coza at any hour of the day. Luckily, the out-of-hospital physiotherapy treatment sessions do not require pre-authorization, and this is subject to the available benefit limits. Now, at the end of the year, we all know that medical funds becomes exhausted, so always make sure that your patient signs the informed consent. When we look at GEM's laparoscopic procedure, they've revised their benefit. Previously, 2 physiotherapy visits for laparoscopic procedures were given. Any additional visits requests for these conditions may be approved for complications for difficulty in breathing or request a letter of motivation for any other reasons. The revised funding as from 1 August 2016 states that 2 physiotherapy visits may only be approved for complications during or after the laparoscopic procedure. These types of complications could be for difficulty in breathing, but GEMS may request a letter of motivation for these reasons. An authorization letter will be emailed or faxed to you. If the authorization is declined, the reason will also be provided. It is important to read all the information contained in the letter. Authorization is given in the event that all the information is clinically appropriate for the patient. This still does not automatically mean funders will pay. The patient may have run out of available funds. So although the authorization is awarded, the account is still not paid, and it is then for the member to be liable. Patients that are admitted to the psychiatric hospital will only receive 3 sessions that also needs to be authorized. Authorizations that are requested telephonically receive an authorization number immediately. An email or fax will confirm the authorization number after the telephone conversation. The following information is required for a pre-authorization request. The patient's details, including membership number and date of birth. The hospital practice number, the date of admission, the reasons for admission, the ICD-10 code specific to the physiotherapy treatment, the NRPL codes related to this position. This is the physiotherapy treatment codes. The treatment codes must fit in with the ICD-10 code, and the treating practitioner's practice number. Remember, the ICD-10 codes must be obtained from the referring doctor and not from the hospital case manager. This is the policy at especially all life and Netcare hospitals. Remember, note number 2. The referring doctor's practice number must be stated on all accounts. Not the hospital or the physiotherapist's practice number, but the referring doctor's practice number. Should you have any further queries, please make sure of the following contact details for GEMS. The problems that we see with authorizations are the following. Physios send accounts in before they received authorization numbers. So the treatment has been done, but as there is no authorization number stated on your account, the claim is not paid. The physios did not update that the patient requires physiotherapy. Let us consider the following patient. Mr. X was admitted to the hospital to have a lumbar fusion. After his successful back operation, he should be discharged on day 5. Mr. X is generally a healthy man, but due to some reaction to the medication, Mr. X suffers from severe low blood pressure, so much so that he cannot move, sit upright, or feel safe enough to mobilize out of the bed. Mr. X spends a lot of time not moving in the first 3 days, and he develops a deep vein thrombosis. He is now moved into the high care unit and receives treatment for the blood clot. He ends up spending a month in the hospital after also suffering from the hospital-acquired pneumonia. Can you see that you have to phone GEMS almost daily to alter the ICD-10 codes and change in the diagnosis? Because the change in diagnosis will lead to the physiotherapist to change their treatment, and also there will be a change in the codes that you use to bill. Problem number 3 that we see with authorizations is that the hospital case manager has not updated to the fund that the patient was referred for physiotherapy. The reasoning then will reflect as insufficient clinical information. The physio must ensure that they clearly reflect in the patient's hospital notes that the patient receives physiotherapy for whatever reason. Remember that the hospital case manager are employed by the medical schemes to assist in their administrative processes at each hospital. They see all the patients for a specific medical fund in a specific ward, section or hospital. They do not only tend to your patient, they also fall behind schedule on their administrative duties, and hence they don't update timeously, stalling the whole process. Think of a patient that gets admitted for dehydration. The patient fell down, requiring physiotherapy for severe backache. The hospital notes should clearly indicate that the patient is receiving physiotherapy, the reason for the therapy, and the correct ICD-10 code that pertains to that treatment. The physiotherapist must also state what treatment she is giving. If the notes do not clearly reflect the reason for the physio, it does not make sense to use the ICD-10 code for dehydration. Physiotherapists do not treat dehydration. The information for the authorization process will therefore differ from the account, and it will then be rejected. It is very important that the same information that is in the hospital file is also used for the authorization process, and the same information is also reflected on your account when submitting it to the fund for payment. In the event that authorization is received for lung therapy and there is no ICD-10 code for the lower back operation and its treatments codes, the funder may only pay for some line items, as there was not enough authorization for all the ICD-10 codes. Let's look at Momentum Health maternity cases. There's some entry criteria in the Momentum Health maternity cases that will give you authorization to treat and that will be paid for. In the event where a post-cesarean patient has pre-existing lung disease or post-operative respiratory complications, where the patient has one or more predisposing risk factor for venous thrombosis embolism, or a history of the VTE. In the case where there is severe wound infection or any malignancy present in the pregnant lady. If the expecting mother is on current TB medication, whether she is HIV positive or have an autoimmune disease, if she suffers from chronic cardiac insufficiency or has a metallic prosthetic heart valve, if she suffers from obesity with a body mass index of above 40. This will also lead to delayed mobilization. Let's have a look at the pre-authorization request process. This can be done via the utilization management system available on the MedScheme website. So go to www.medscheme.coza. The application form and training manual for the utilization management system may be obtained by emailing tolo@medscheme.co.za. Online training may also be arranged by appointment, and appointments can all be done via the above email address. Open the MedScheme webpage. In the top right-hand corner, you will find the drop-down box indicating your role. Please select the appropriate role that you have been registered as. You will select Hospital Web. Press Login. Enter your username and password, then click on Login. The system will require you to use the username. Your username will always be your practice number. For the first time that you log in, your password will also be your practice number. When you select to log in, it will prompt you that the password has expired. If you have entered your password also incorrectly 3 times, your username will be disabled. Please click on the link provided to have your password reset. This will open an email which you will need to send the password rules. The password must be 7 characters or longer, but not longer than 40 characters. The password may not start or end with a number. The new password may not be the same of any other 12 recent passwords. The password must contain at least 1 upper, 1 lowercase, 1 numeral, and 1 special character. You will be prompted to change your password every month. Make sure you always write your passwords down and keep them in a very safe place. In order to continue, please accept the terms and conditions. When a new PL, pre-authorization request, is being loaded on the system, 2 methods can be used. You can select the PAR or member option. The UMS prefers choosing the member option. When the screen opens, you can search the member either via name, surname, or membership number. Make sure that all the patient's details are captured correctly and press Continue. You can maintain the member by adding more information, updating information, and or looking at information you require. You can look at the patient's benefit usage to see what funds are available to you. Or from this screen, you can choose to create a PAR request. Creating a pre-authorization request is a request for authorization. Add the admission date, the role you as the provider is playing. We are never the admitting provider. Add in the ICD-10 code details, if it is the primary or associated ICD-10 codes. Think of our back operation patient and how his ICD-10 codes changed. Make sure you select the in-hospital option and save your request. This request has been logged and it will now only be referred to the funder, the clinical department, for further evaluation. After more evaluation, to see if the requested treatment falls within a certain protocol package or if it is clinically relevant, they will authorize it. The funder have notes in the notes section there for you to read. Example, it's valid and active chest physiotherapy, suctioning, ventilated. Option 2 is to select the PAR to create the pre-authorization request. In the event that the PAR request is loaded and approved, the PAR number will appear in this block. Use this number on all your accounts and in the patient file. Authorization for specific treatment for a specific condition or conditions were granted. This still does not mean the account will be paid. If there are items on the account for which authorization were not obtained or requested, these lines will not be paid. If the patient has run out of an available benefit, there is no funds left and the account will also not be paid. For HOSMED, Umvuzu, Transmed and Tebimed, send an email as soon as possible after admission. This email is to confirm that the patient will receive physiotherapy If possible, give the ICD-10 code for the required treatment and the reason for admission. Remember to give the practice details, and the practice number and the hospital pre-authorization number will be linked. This helps to lessen problems going forward. For HOSMED, you can send an email every 3 days to confirm that the patient is still receiving physiotherapy. And then with discharge, follow up with the fund via email or telephone. For bonitas, remember to use the hospital authorization number and make sure that the case manager has updated with the fund that the patient is receiving physiotherapy as well. Remember, this is not the case manager's responsibility. At the end of the day, it is all about communication between the doctor, the physiotherapist, the case manager, and the funder. Discovery Health has not instituted authorization measurements as yet, but at some institutions, they do require a referral form from the admitting doctor for in-hospital treatment. Also note that the referring doctor's practice number must be reflected on your account. Be patient. In the event that a rejection is received, make sure that the case manager has updated the information on their side. This is usually the delay, and the physio's account is received by the funder days before the case manager has updated. Keep calm and send again. For the out-of-hospital authorizations, it's only Fed Health and Bonitas that ask to have the referring doctor or family practitioner's number stated on your account. This forms part of that particular scheme's managed care package. Although we are the first-line practitioners, meaning that we can treat without a doctor referral outside of the hospital, we have to respect that each funder will have their own way to curb cost and manage healthcare in the private health industry. Always remember the SMARTY jar. Thank you for being awesome listeners. Any questions?